This is Dr. Noor, one of the children's doctor in this hospital. Am I with Mrs. Kriza, the mother of Sam?
Yes.
Nice to meet you and thank you for coming here. Today, I will take some notes from you about Sam's development. Is that okay for you?
Yeah, I'm fine.
Okay, so Mrs. Kriza, can you tell me what are your main concerns about Sam?
Actually, Dr. Noor, my main concern is regarding this. I think Sam is not appropriate for his age, and he is not according to his peers. So that's the reason my main concern for him.
Okay, we will try to solve this. So can you tell me when did you notice that he is slow compared to his peers?
Yeah, Mrs. Noor, Dr. Noor, issue is was that Sam was fine up to I think 1.5 year when he had some vomiting and head pain, and then we found out he has some brain tumor, and then he had a surgery, and now he is on chemotherapy. But he is not just like other child. He has difficulty in pain, walking, and other issues.
So it was at the age of 1.5 years, it was diagnosed that he has some brain tumor, and surgery at what age it was done? The same age?
Yeah, takriban approximately 20 months it was done. When he was on 20 months, surgery was done.
Okay, and he is on medication still? The what you said, chemotherapy, still he is there, or it finished? He is done with
Yeah,
it.
it's finished just 6 months ago. It's finished now.
Okay. So I want to ask you, did you notice any time he acquired some skills and he lost it? Have you noticed it any time?
No. That just like before, he was walking the right way, but now when he is walking, he is shaking. He's moving from one side to the other side. I'm always in a fear that he will fall at any time.
Okay, so in walking, you notice that there is tendency to fall. Oh,
Yes.
okay. And I also want to ask you, do you notice any weakness in any part of his body, like hands, legs, any weakness you feel?
Whenever he hold anything, his hand starts to shaking, and his grip is not strong. So I'm also worried about it.
Okay. Do you see any difference in his right hand and left hand, or right leg and left leg? Any difference you see
It's
in
not. Mhm.
strongness?
Yeah. You are. I feel that his right side is more strong, and left side seems to be weak.
Okay, right side is strong, left side is weak. So I will ask you some questions about his development. Now, he said he walks, but he has tendency to fall. Can he run
He run, but stiffly, not smoothly.
stiffly? Have you seen that he will fall? He's falling when he's running anytime.
It looks like, but he never fall.
Okay, so has he tried walking on a straight line anytime, like what we call it as, it means one leg in front of another?
No. I never noticed this one.
Okay, I want to ask you about his speech. How is his hearing? Is it fine?
Yeah. Hearing is. Yeah, he can hear whenever we go, but he needs to speak. We have to speak loud, then he can hear. Otherwise, when we speak in whispering, he was unable to listen the thing.
Can he sing the song? Is he able to, you
He
can understand his wordings? I mean, can he communicate? You can understand his wordings?
can sing the rhymes, but we are unable to understand.
Okay, but can he tell a story anytime?
No.
Okay, I want to ask, is he able to hold the cup and feed? Means spoon and feed?
Yeah, he can.
Okay, is he using both hands or which handedness use? Okay,
Right
any,
side. Right
okay.
side, he can hold the things approximately very in a very good way.
Is he still in nappies?
Yes.
Okay. Anytime he expresses his needs that he has to go to toilet and you remove it anytime?
6 minutes.
Yeah. He has to. He wishes, but due to
6 minutes.
his falling condition, we are unable
Write about
to.
them 6 minutes, huh?
Okay, yeah, okay. Okay, can
Due to his falling condition and difficulty to go to the toilet, so we have to put this pamper.
okay.
But he explain us that he needs
Mhm.
to go to toilet.
Okay, I want to ask you about his during the birth. When you were pregnant, did you had any problem when you were pregnant? Anything was noticed?
No, nothing.
No.
Pregnancy was
Any
normal.
scans were done for you, jelly scans, and did they told you anything?
Yes, it was done at appropriate time, and they were normal.
Normal. So after immediately after birth, anything you noticed like difficulty in breathing or any problem?
No. After birth, he was fine, but only had some yellow discoloration of the eyes. So he admitted in the nursery for a few days, but he was discharged without any complication.
Was he given this blue light? You know the blue light they give for
Yeah. For 1-2 days they give, but after that he was discharged.
nothing else was done, right? In means blood, any change, they changed any blood or nothing?
No, nothing.
Okay. So then immediately after birth, you said these things, but apart from that, later when he was growing, before 1.5 years, he had problem. Before that, any problems, any admissions?
Only he has difficulty in her eyes. His left eye moves to the towards the nose, and for this one we consult ophthalmology, and they put some patch or something. I forgot exactly, but they put something to the cover the eyes.
Okay. You feel that he has problems with his vision? He is wearing glasses?
Now he is very.
Okay. So I want to know about the social history. How is he coping up with this condition? You as parents, how are you coping up with his condition?
It's difficult for both of us, but we tried our best, and we have a maid, so we all three people can manage him.
Okay, you and your husband and you are working.
Before I was working, but since Sam is not good, so I left my job.
Okay. Any financial problems you have?
No, we don't have any financial issue.
Are you planning to admit the Sam to school?
We are planning, but we are coming to you to guide us regarding this issue.
Okay, we will put an educational plan for him. For working and other children you have, they have any problems?
No, they are fine. All of them are.
Any
approved.
similar conditions? Anyone has similar condition like brain tumor in your family?
My grandfather had, but it was in the later years of his life, but now he expired.
You are following with any teams after his surgery since he is weak? You are following with any teams?
We are following by oncologist and neuro-oncologist, and we are also following by a physiotherapist and education occupational therapist
Okay.
and neurologist also.
Recently any labs or investigations done for him recently?
Yeah, as I told you before, we are following by oncologists. So every 6 months we had MRI.
They said, how is the improvement in this after operation?
They're saying it's static.
Time over.
Okay, so today I took history from Mrs. Kriza, the mother of 4 years old Sam. Sam had been diagnosed with brain tumor at the age of 1.5 years, for which a surgery was done, and he is on chemotherapy. He was on chemotherapy, which was stopped 6 months ago. In his vision, he has squint and he is wearing glasses. He has hearing problem as well, and in gross motor, he runs stiffly. In speech he can sing but cannot say the story, and in social he can just use spoon for eating, and he's still in nappies. And regarding his prenatal history, it was unremarkable. He had only jaundice during the postnatal period, and at 1.5 years, he had this problem for which surgery was done. Presently, he's following up with oncologist and the developmental team and the neurologist. Apart from that, socially, financially, they are fine. Only because of this problem, mother has stopped her job and she's taking care of the child. Okay. So now I will proceed with the examination.
You have still 30 seconds.
Because
Yeah.
we
Yeah.
can use this time. I think if
Okay.
we finish, we can. Okay, so I will wash my hands. Then I will introduce myself to the child and parent again. Then I will check the rapport of the child. So I will ask some question to the child. Sam, how are you? Is he able to speak back to me?
No,
Okay, then I will just look for any unusual features in his face.
no dysmorph, no dysmorph feature.
Okay, then I will check for, look at his nutritional status, weight, height. Is he okay?
He is on 9th centile, his growth and his height on the 9th centile.
Okay. Anything in the surroundings he has brought, any wheelchair or anything?
Only glasses.
Okay, wheelchair, glasses. So now he's not in distress. I will just confirm this. He's well looking, not in distress.
Yes.
Okay, now I will tell Sam, I will play with you. So I will give cubes to the Sam and check how I will show him to build the tower. Okay. Is he able to build the tower?
Yeah, up to 6 to 7 cubes he can
Okay.
do.
When he's building, I will observe his handedness. So which hand he is using?
Right hand.
Right hand. So I will ask the mom, I will ask also him to use his left hand. Is he able to lift with his left hand the cubes?
Only just lift, but not move up, and just
He
only
can move up the hand to keep the cubes.
yeah, he can.
Okay, so he can, so I took it as he can build 6 to 7 towers with right hand, but has difficulty with left hand. Then I will give him a piece of paper. Sam, let's play. I will show you to draw some things. You have to draw. Then I will draw a circle and ask him to draw. Is he able to draw?
He can only scribble circle.
Okay, scribble only. So I will see how is he holding the pencil, and again I will observe which hand he is using.
He's using right hand, and the grip is this minute tripod, minor tripod.
Okay. Then he is just doing circular scribbling. So I will show him to draw a line. Is he able to draw a line?
He can just draw a vertical line.
Okay. Then I will give him the scissor. Is he able to? Before that, I will ask him to use his left hand to do something. Is he able to hold the crayon in left hand?
He only just hold.
Okay, but can he scribble with the left
No,
hand? No. Okay, so I will ask him to give the scissor and ask him to cut. Is he able to?
no. He
I
just
will
hold,
hold-
but unable to cut.
Okay, I will hold the paper for him and ask him to cut. Is he able to?
No.
No. Okay. Then I will give him book and ask him to turn pages.
He can turn pages one by one.
Okay, I will observe which hand he's using again.
Right hand.
So I will ask him, Sam, can you turn with your left hand? Is he able to do?
He can just move all the papers, not
Okay.
specific.
Then I will give him large beads and give a big thread and ask him to, I will show him to put the beads. Is he able to do?
No, he cannot.
No. I will hold the thread for him and ask him to put the bead inside it. Is he able to do?
Again, sorry.
I will hold the thread. I will hold the thread and ask him to just put the bead. Is he able to put it?
No, he cannot.
No. Okay. Then I will ask him to put the board. I mean, I will ask him to put some shapes in the board.
Mhm.
Like triangle, some simple shapes, triangle, square, like this. Is he able to put?
Only two shapes he can do.
Again, I will observe for his which hand he is moving and all in the board.
Right hand.
Left hand he is not putting.
No.
Okay, now I will show him one cube of color, of some color, and ask him to pick the same colored cube. Is he able to pick it?
No.
No. Okay. So I'm done with examination. Can I present? Still there is time?
Yes, yes. Still there is time 3 minutes. You can present.
There is still time, but you can proceed.
Okay. So today I examined Sam, who is 4 years old boy. He's not communicating well, well looking, no unusual features, and his weight on 9th centile. I would like to plot him on the appropriate growth chart for age and sex, and he's wearing glasses. On my fine motor examination, he was able to build a tower of 6 to 7 cubes using the right hand, but with left hand he had difficulty, and he has right-handedness. With crayons, he is able to do circular scribbling with right hand only. Left hand he could not do it, and he was not able to demonstrate cutting today. And the books, he was able to turn single page with right hand, multiple pages with left hand. Beads, even with help, he was unable to put, and board he can put only 2 shapes. With these findings, I will give him a fine motor age in the development of 2 to 2.5 years with his right hand, but he is unable to demonstrate these skills with his left hand.
Okay.
Okay. So you can proceed with questions.
Dr. Yasser, your questions first.
Okay. So would you like to summarize the case?
I
She
summarize.
has summarized.
You want again summary from
No, no,
home
no.
forward?
No, she
No,
summarized.
no. Okay, fellas.
Oh.
Okay. So what is your diagnosis?
So my diagnosis in this child is a case of post-surgical complication presenting with ataxia and hemiplegia.
Okay.
With weakness in the left side of the body, with demonstrating the global developmental delay in all areas of development.
Okay. So what do you think? What are the causes in this case? one is surgery and others.
It's first, it is the space occupying lesion for which surgery and chemotherapy was done. And it can be a post-surgical insult to the brain, which has led to the to his ataxia and hemiplegia. So maybe this is posterior fossa tumor.
Would you like to tell me what is the mechanism?
Usually in the posterior fossa tumors, there will be a surgery done, and due to the extraction of this, there can be damage to the cerebellum. This
Mhm.
can cause ataxia in these children. And maybe due to the upper motor neuron lesions, he has this hemiplegia as a complication of surgery.
Do you think this global developmental delay is due to surgery?
It can be both from his space occupying lesion, which had developed increased intracranial tension and some damage to the brain, and also post surgical damage, and also chemotherapy.
Okay. Would you like to tell me how can we follow up this patient or manage this patient?
Yeah, for the management of his development, I want to involve the whole developmental team, including community pediatrician, to coordinate with all the teams, and a physiotherapist for his gross motor improvement, occupational therapist for his eye and hand coordination and house modifications, and speech and language therapist to improve his articulation and speech, and also play therapist to improve his play in the social field. And also I want to involve the social worker and dietitian also in this patient, and to neurologist and the oncologist as regular follow-up of this case.
Okay. Who will be the pivotal in all the, who is arranging all the subspecialties?
Community
case?
pediatrician will arrange for all the developmental team, and the oncologist and the neurologist will follow up him in the hospital.
Okay, time over.
Time over. Okay, thank you. I don't know. Okay, give your feedbacks, and I don't know where I did mistakes also. And if there are something lacking in my history also, I don't know.
No,
First,
no,
Dr.
everything.
Yasser will give, and then others, Rohel and.
Yeah, Dr. Yasser, if you want to give, then I will give.
Yeah, for me, everything is fine. Only if we find just like he's unable to proceed with the large threads and the beads, we cannot go further. Any means if we know that he is just like he's falling 2 and 2/2, we don't go beyond 3 or 3.5. Otherwise, it's quite nothing is for me, and everything is acceptable. Everything is good.
I will give you feedback.
You
Dr. Noor,
want
take it.
You want to say that if he cannot do the thread, then you will not go the further, right?
Yes, yes,
Yeah,
yes.
yeah, but I did not go further, right? Where did I go? Board, I asked. Board, he even the less age can do. Large beats he cannot do. I did not go for small beats.
Okay,
Scissor
okay.
he cannot kept. So okay. Let Dr. Rohel give his feedback.
Okay.
Yes. First of all, in the history, you start very nicely. What is your concern? And Dr. Yasser said that this child was completely fine, and then 1.5 year of age, he was diagnosed with some brain tumor, and for that surgery was done, and so he was still that fine. So then you should ask one question, I think so. So when did you notice after that? When did you notice that he start regressing his achieved skills?
I
Mm.
asked
Okay.
this question, he said no.
She asked this
No,
question.
just I have written each and everything. You
Okay.
asked that. I know you asked that, but you were asking like before this time, like from the beginning. I mean to say, you should ask a question, which I always love this question, and I have this seen in so many meetings abroad. This in UK, they are asking like how it is progressing now. This one question should be
How
asked.
should we ask? How should we ask this question, Dr. Rahel?
Yes, how it progressing now. When mother said that, I have noticed from like after the surgery, 6 months after that, I am thinking that my child start regressing his skills, and he was not able to do this and that. Then you should ask how it progressing now. So this will
Ah,
give you a clear cut clue that this is CP child or anything else, because here is the tumor. Maybe the tumor is reforming. Okay,
okay.
this is brain tumor. So this will give you that maybe some insult to the brain has been occurred, or if it is progressing further, so that's mean there is no CP. That's not mean that insult has occurred and he lost his achieved skills. That means that there may be this tumor is growing now further, and this tumor is giving the pressure changes to the brain, and that's why he's losing the skills day by day. So how it progressing, one thing. uh, Even though Dr. Yasser asked you about told you about the multidisciplinary team, you should ask by yourself, because it was happened at 1.5 year, and now is child is 4 years old. So you should ask at least any this child development team has been involved so far or not, and what you have done so far, any physiotherapy is going on, or anything you are doing, or any doctor is doing for that. So this will give you a level of what child is achieving at the moment, from the medical team. So it will be helpful when you are giving the answers, that will be helpful for you. These two questions. And in the pregnancy, you did ask very nicely, complete history was very good. And in the social part, so that was also completely fine. You ask about the financial issues, you ask about the, so there in the social there should be asked like what we were discussing before, like disability living allowance,
Yeah.
and respite care,
Mm,
and this one portage care,
mm.
Mm.
and
But,
should,
okay, means this is because he is now 4 years. It is his has problem is going on from 1.5 year. It's like a
yeah,
case same like CP.
Chronic. It's like chronic now,
yes,
no?
this is
Chronic.
now like a chronic case. So it
Mhm.
will give you a clue, Dr. Noor, that when you will answer that, definitely they will ask you how will you help this child. So we are not just saying that we will involve the multidisciplinary team like in the form of occupational or physiotherapist and other things. All this will give you clue that he's taking already disability living allowance, or he's taking already respite care, he's taking portage care. Portage care here will be not, but in others areas can be, but because portage care is coming in the form of like palliative care, I think it's
Mhm.
not
But the
coming here.
respite care will also be for these patients apart from CP. It's not only for CP.
Yeah, this is respite care is also for like no, this respite care is for palliative, which I remember, and portage care they are coming at home, and
Home.
this is kind of nursing. So
Yeah,
if
like
they
if
have
they
some,
have central line, if they have central line to
yeah,
take
if
care
they
of those.
want central lines or some anythings like these kind of. So there are few others things like they are using this senco or send. This is special education and coordination. Some institute is there, they are helping, and there is sand also. I will see these one, all these,
No, I
and
know.
will,
Wait. For this Senko, they will evaluate
He
the
told
child.
us, right?
Yeah,
They
yeah.
told us
Yesterday he
something
told.
about
Senko is like the school, you know, the school.
yeah,
In
yeah,
school, it will be there in the school. It will evaluate the child, that this child is able, can be given disability living allowance, and also
yes,
for does he needs, he can educate
special,
in a normal school with assistance, or
yeah.
he needs special school. These three
So
are.
yeah, he's 4 years old. So education, you should be asked, if even though he's not going to school, you should ask that what is your plan. He's now 4 years old. Definitely, you have plan in your mind for admitting to school. So did you have discussed this one or not?
Yeah,
I
yeah.
think what they are asking us, they don't want us to know that what is the diagnosis or something like this. Even today, one of my colleague, she has given this exam. She was saying that they don't want what is diagnosis. They want how we can help this child. We are
Okay.
safe doctor for
Your
this child
colleague
or not?
in UK or what? The exam.
UK.
Yeah. You will just forward us all the cases, huh? Once she's free, take the
Yeah.
one-to-one
So
forward me. Huh?
uh, one yeah yeah this is all in the history. In the examination you did very well, but which I think so, you ask about the no, sorry, in the history still, in the history you ask about other parts of development, like you ask about how he's running. So child is 4 years old, even though you know that he's having weakness of the left side of, and hemiplegia and some abnormal movements, ataxia is there, even though you know. So you should ask, which I am thinking, that from the 4 years of age, from the other domains, this will give you clear cut clue that the child is
I
behind
ask
in
like
all.
jumping. Is he able to jump or no?
You ask about the running. So running is coming only for if he can run on tiptoe or not. Tiptoe is coming for 4 years. Yes.
Yeah.
So tandem walking, I don't think so. Should ask about the tandem walking forward or backward, because this tandem walking, even though in my child, I cannot say that he can walk or not. I am seeing daily, but I cannot say, because I am not bothering for this. He's walking tandem or not. This is not a just all the childs
Not a
are doing.
history question. You mean this is not a
Yeah,
history question?
yeah. In the
Yeah.
history
It's a
question, like
point to
four
be
years,
noted. Yeah.
yeah. In the 4 years, like if you want to ask from the grass motor, 4 years you should ask about which mother know how is going upstairs and downstairs. So she can tell you he's using 1 feet or 2 feet, or how going there. You can ask about the jumping like hops. He can hopping or not, like this. He can run on the tiptoe. These all are 4 years. And mother will say, no, doctor, I think he cannot do. So this will give you clear cut clue that his gross motor is also delayed. Then you are coming to the, which I have written, just 1 minute. Uh, Hearing and speech. So for the 4 years, if you want to ask, you can ask about child knows his address. If I will ask, he can tell me the address. So address is coming at 4 years. Or you can ask, child knows uh, different colors, how many colors he knows. At 4 years, usually normal child, they knows four colors. Okay. Or even you can
yes,
ask about,
3 colors, 3 years, 3 colors, 4 years, 4 colors.
yeah, you ask about the tell a story, that is very fine, because tell a story is at 4 year. So
Right.
Dr. Yasser said no, he can sing a song but cannot tell a story. So again, song at 3 years. So it's coming behind. So that will be a good question. And even you can ask, he can hold conversation. Conversation is also at 4 years. Child, they can do conversation at 4 years. Then you ask about he can use spoon and fork. Rather to say use spoon and fork, just say use spoon, fork and knife is coming at 4 years. So I think which our chronological age, we should in the history start from that. It will give us the clue that the child is behind in all globally. What do you say, guys?
Yeah. This is very nice way, yeah, to ask.
Yeah, we have to write it like 4 years, what is relevant, we have to write in one place.
So,
3 years, what is
so
relevant, 2 years, what
yeah,
is
so
relevant.
we cannot remember. I cannot remember even in the exam tension, and I cannot remember that now 4 year. What should I ask? So what I am thinking, if we have 4 years, 4 minutes. 2 minutes we will make a template, and 2 minutes or 1 minute we can write the chronological is 4 years. In the gross motor, I need to ask this one. In the chronology, this speech and language, I want to ask this one, and in the so that will be a very good. You are asking like this. You
Yeah,
can
I
write
have
these
one
in
more
your question.
idea. I have one more idea. Instead of asking
Yes.
exact at 4 years, if I ask at 3 years, it will be better, because if he is not
Yeah, that's
performing
also fine.
because it will save our time. Now, if they tell that he is not able to hop for 4 years old, if he's not able to hop, then I have to ask him about jumping in place, or I have to go back and ask, is he running swiftly? Is he not
No,
running?
no, 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 no. This is for history. In the history, you will ask other domains only 2 questions. You understand? This is for history.
That's why. So for the history to maybe it will be usually delayed. So if we start from 3 years, suppose if this is a 4
Yeah,
year
3 years,
child,
okay, no problem. 3 years, not too much like 2 years or three. 3 years, okay, no problem. 3 years, like
years
the child
ask
is
and
age.
increase. If she says yes, he can able to do, I will increase. If she says no,
Yeah,
I
yeah.
will decrease one more question and go forward.
Yes. So this will be in the history. In the examination, you did very nicely. I don't think so. There was anything which you have left from your side. Uh, you ask about wash my hand, unusual features, height and weight. Just a few things you can add here. Two things only. You should come behind from to check his hearing and check the
Yeah,
eye
this is what I
alignment
wanted
for
to ask
this.
you, Dr. Rohel. Dr. Rohel, I wanted to ask you this question regarding the hearing. This what we had from the course. They said when you are asking the question initially, you should ask the hearing and vision from the start. Is it like that, or I will go by the age?
No, 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 no. If in the examination, I'm saying in the examination, like people are saying that to
Mm,
check the child's hearing, just come behind the child, just
mm.
like no verbalize. So we will say that I will come from behind the child. In the
Mm.
ears, I will say, ask his name or
Call his
ask
name.
anything. Call his
Please.
name.
But it will be
Call his
starting
name.
for speech, right? They might misunderstand us that we are doing speech and hearing for him.
No, no. You, Dr. Noor, you will say that I'm checking his or her hearing only.
Oh, okay.
Okay.
Mm.
Home two questions they are saying that, like call, I will call his name, and will ask with whom you came today, like this. Two questions you can ask. So this will be for hearing. And for the glasses, you should check always, say that I am looking for she's wearing or he is wearing glasses, or eye alignment is equal or not. Okay, this is for the squint,
Oh,
because
okay. You want to see
squint is,
them whether there is any squint.
No,
If
no.
yeah, if there,
For the fine motor, I think yes, we have to comment on the
yeah, yeah,
eyes, which I did not ask. Yeah, means
yeah,
even
this
in
two.
examination, I have to ask particularly for the eyes. Is there any squint? Is there any nystagmus? Or is there any? There he was telling no, there is some palsy in the eye. Means the eye
No, no,
left eye
he was
moved
telling
towards
you
nose.
squint was there. I think he was telling squint was there.
yeah, he
Yeah, for
said squint
which
is
Yes,
there.
Dr. Yasser.
amblyopia, I think it's amblyopia for which they were using patching the eye. This is what I
No, no,
understand.
it's
Yeah,
simple
yeah, yeah.
squint. It is simple squint.
Simple squint,
Uh,
he
yeah,
said.
yeah.
Yeah, simple squint can
And
cause
they are using
amblyopia,
patch
right?
to close the eyes. But due to this,
Amblyopia is high pressure in the eye. It's
No,
like
no, no,
glaucoma.
no, 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 no. Amblyopia means due to squint, what happens? He cannot see one eye in one eye clearly. That eye becomes
double image, there are double image.
Double
So
image. Okay, okay, okay.
no. Amblyopia is not like that. Go back and read today. I will tell what is amblyopia. Now, suppose you have two eyes. Okay, one eye
Mhm.
has squint. Okay, Because of
Okay.
it, he cannot see. One eye is normal, means he can see very well with this. With the squinted eye, he has difficulty. Then what happens? This eye becomes weak, means he will stop using this eye much, neglected like
Oh,
this.
you mean the compensation for the other
Yeah.
eye?
So
Yes,
this
yes,
eye he will
yes, yes.
be. So at that
Mm.
time, what they do, they will patch the good eye, so that
Okay,
he will
got
start
you.
using. Means suppose this is non-paralytic squint.
I got your
What
point.
happens when you patch this eye? He will start coming in center and he will start watching it through this eye. This will make it strong. This is the amblyopia, and the treatment is patching eye. This is what I understand from his.
I got your point. Yes, yes, yes. You're right.
Go back
Okay.
and read about it. Yeah.
Then in the examination, completely fine. And Dr. Yasir, you use this minute tripod. Minute tripod is coming at 3 to 4 years of
3
age.
to 4 years. Yes, that's what I was looking also for this minute
Yeah,
type.
I think you should use for that quadripod. Quadripod is coming 2 to 3 years of age.
You remember that image? Palmer grasp is 1 to 1.5 year. Then
Yeah,
tripod is 2 to 3 years. And then static tripod grasp is 3.5 to 4 years. And then the
yeah.
dynamic tripod, the normal dynamic is from 4.5 years to 7 years.
Yes. So, and in the question, Dr. Yasir asked you what may be the cause. You did very well. This is the cause of. So one thing, just add. I will just add. I don't think so. It's good or not. You can say that this is all maybe due to the post-surgical sequelae, and maybe the new reforming of the tumor, and it's affecting his centrally and peripherally. Okay, central means there are some central causes which can cause the uh, delayed development, and there are some peripheral causes which can cause the delay of the development. So peripheral causes also coming here because they may have this hemiplegia is there, and they have ataxia. So definitely they may have now 3.5 years, or no, 2.5 years. So in 2.5 years, definitely some muscles weakness also develop. So you can say that it's affecting him peripherally and centrally. So these are the two main causes here which I am thinking.
It cannot be because of the chemotherapy also that he has
Yeah,
delayed.
that also good. Chemotherapy itself can cause some drastic
Yeah.
effects. So that can be covered here. And one more thing, when you ask, you were asked about how to help or how you manage. That was completely fine. You did answer multidisciplinary team and each and everything. And here again, tell about the education, and may child need special education or not. So I will also involve for, uh, for that. I will also discuss about that, and also for the psychologist and psychiatrist for the for the family and the
Family
child,
support.
for the family and the child itself, and education of the parents also, how to cope with all these. And if she, I could not listen if she was having this financial issues or not. So that one should be involved, this all DLA and respite care or portage care. Otherwise it's completely fine.
That Senko is that one, a special education need coordinator.
Yes, yes. So otherwise completely fine from me. Eh, Examination was completely good. I don't know how we can remember, Dr. Noor. You remember all these things very nice.
Mashallah. Mashallah.
Mashallah.
Achha,
Pure
Dr.
template.
Ruhel, regarding the diagnosis, I think there are three things only. As Dr. Two of them, Dr. Noor defended, the raised ICP could be a cause of this one in the initial stances, uh,
Mm.
that causing his involvement of higher mental status and this hemiplegia. And second is chemotherapy, most likely this methotrexate encephalopathy, just like this one. That could be a sequel. And
Actually, Dr.
third
Yasser
thing,
here,
metastasis.
Yes, yes, this can be, but you know, they are not asking these questions in the
Yeah,
exam.
yeah,
I
yeah,
have,
yeah, yeah, yeah,
yeah, I have so many people, and you know, this Dr. Aftab is my
yeah, yeah,
best friend,
yeah, yeah,
and he
yeah,
was
How
yeah.
telling
was
me
his
also, they
exam,
are,
Dr. Hale? How was his exam?
yeah, he will pass. He is good
Inshallah.
exam. He is
Inshallah. I
completely,
hope for Aftab and Dr. Abbas, they will pass, inshallah.
yeah.
All of them, inshallah, will pass.
So,
Inshallah.
actually, you know, Dr. Yasir, they are asking only like, what do you think? What may be the cause behind this? They know you have told by yourself this was surgery was done and there was a tumor. So, if you will say that there was a tumor and there was surgery was done, this is not an answer. You have already this has been given to you. So, what may be the cause behind this? So for that, you have to tell that this is most probably post-surgical sequelae that is affecting the child centrally from the brain level and peripherally from at the muscle and the bone level also. So that's why he's not able to do the fine motor uh, skills
Skills.
at this. Yeah, like this you will have to tell.
Okay, okay. And the
It's
second thing,
very
we
fine.
left only one thing, investigation. When somebody is asked for management, so we have to first and tell us the investigation, and then we can involve the multidisciplinary team.
Yeah, regarding the investigation here in this case, there is no need of any investigation at the moment. Almost you can do only CT scan or MRI. Still this is giving the
But we
stress.
can say we can review the latest
Yeah,
MRI.
previous notes, you
Yeah,
can
previous
review the
note.
previous notes, and like Dr. Noor rightly said, she will review the red book also. So this is investigation basically. After that you will decide what to do
Okay.
next.
Because there will be a lot of things done already.
Yeah,
Actually,
yeah.
Yeah.
So
I
we are
did not
using the
tell in
word
order to
review.
complete my examination. I did not tell, I think.
Yeah,
No,
yeah.
no, not done.
Like Dr. Noor, if it is the case, for example, is with you Williams syndrome or Down syndrome, then in order to complete, you will have to tell. Even if you have time, you can say that if the mothers raise the concern in the history that the Down syndrome baby and he was having this cardiac problems, or he was having this thyroid problem, something like this. So if you have finished your examination, development examination, and you have left 3 or 4 minutes like today, so you can say that I would like to do further examination as the child is Down syndrome. So for the associations, as the mother has raised the concern for cardiovascular and the thyroid problem, so I would like to do for that examination. If the examiner saying okay you can do, okay. If he saying no problem, leave it, then no problem. Just to for the association, especially in the syndromic baby.
So here what I understand from you is the cause for the developmental delay is one is the space occupying lesion itself before starting of vomiting, raised increased
Yeah,
intracranial pressure, then the surgical sequelae and the
yeah.
chemotherapy and some any
Chemotherapy.
metastasis. Okay.
Hmm.
And you said reforming of the tumor.
Yeah, maybe possibility reforming of the tumor.
This
And
peripheral
that,
causes is again, it is the sequelae of the central cause, like the insult in the
yeah, yeah,
brain.
this is, yeah, like
He
in
is not
CP child.
using his muscle, so there will be muscle wasting.
Yeah,
And
there
he is
can
not,
be muscle wasting. Like if I have some this palsy, what we call this Erb's palsy, if I have this on the right hand, so I cannot, I'm not able to do this writing or something. So I have fine motor delayed on the my right side. This is all due to my muscle is not working. There is wasting of muscles is there. So that's why I cannot do. I cannot hold the pen. For that, they are saying that you will have to tell that we can use a big pen. They are using in UK. This is a big pen, and for that they can hold easily. So that's why this is the peripheral causes like muscles or some bone
and also
problems.
one more history is very important here. see, most of the people are right-handed, but some people can be left-handed also, but most are
Yeah.
right-handed. Suppose
Yeah.
they can also bring a child before operation, 1.5 years. We can use like what hand he was using.
Yes.
Means before 1.5 year, before he developed all these symptoms. Maybe at that time he was active with his right hand, but after symptoms, maybe
Yeah.
he stopped left hand and came with right. He started using left hand. This will also give us a clue.
Yes. Yes. This is a
Say,
very
"Kids,
big
I
clue.
did not ask." Now I am
My
thinking.
teacher, no, my teacher, he's in grade 2 when I was in grade 2, and he was using left hand. And I asked him from the birth, this one, I remember this one. He said, no, I got this accident, and I was he was telling me till 10th of class, he was using right hand.
Mm.
Then after that, he developed this left hand and is very good in left hand.
Mhm.
After 15 years, he developed.
Yeah, that's what anything can cause. That also is very
Yeah.
important. Asking the handedness before surgery and asking the handedness after surgery also.
Yeah.
But
Yeah.
what
Yeah.
ultimate feedback for me, this one feedback given by Sarah is good. For Sarah, they had given the case like posterior fossa tumor, but for Satish, it was presented only as hemiplegia. Satish told me just as hemiplegia. And he asked like separate
Same case.
to know, yeah, how he got to know hemiplegia was just one question helped him, like do you feel any weakness in any part of the body? This question helped him in the for the role player. When he asked this question, do you feel any weakness in any part of the body, the mother said in that case, I think left hand was weak, no, right hand was weak in that case. Right hand was weak, and every task he was doing in the station, he was asking like, is he able to perform the same task with left hand or not, just to confirm, so that at last he can present that this is probably a case of hemiplegia.
Very nice.
This is what he told me. Like, and also when he asked to cut with the scissor, the child was not able to cut with the scissor himself. But when he told that I will hold the paper and ask him to cut, he was able to cut. And when he asked another for beads, if he asked to do himself, he did not do. So when he told that if I hold the thread, can he do? He was doing with right hand, but not with left hand. This is what the response he got. Like this something, it means depending upon your case you can manipulate the things like what you
Yes.
got from
Yes.
the history.
Definitely.
Okay, just be careful. If you get any, they can repeat the same case or they can do some manipulation in this. So if it was
Okay.
just hemiplegia case, how you will present? Again, it's a post-surgical, maybe a post-surgical sequelae.
Yeah. Post surgical sequelae can be there, or some metastasis very less likely. The reforming of the tumor, it can be there, and yeah, these
Chemotherapy.
two things. Chemotherapy very less
And,
likely.
but
Hemiplegia will.
malignant tumors are less common in children, right, compared to
Yeah,
adults.
less
So
common.
even we can consider as benign tumors and most probably surgical sequelae. Chemotherapy means
Yeah.
it's malignant. Only if they say chemotherapy, we can consider it as malignant. Because
Yes.
statistically, the more common tumors in children is
Yes.
benign
Malignant.
tumors. Benign
Benign.
tumors.
Oh,
Yeah,
benign tumors. Okay, next we can do now.
yeah,
And
yeah.
in
We can.
hemiplegia and diplegia also consider CP. The if it is since the mother noticed that he's this since birth he is not using and had preference. So always think about CP. The diplegic and hemiplegic CP can also present in the
Yeah,
scenarios.
yeah.
You mean in the same way, like weakness of the one side?
Yeah. If there is no history of any tumor or anything during the history, but
No
mother
tumor
notice he is
trauma. If there is no tumor trauma, then you would think about the CP.
CP. Yeah.
No, for the CP, okay. Actually, the
Sorry,
pre-treatment-
hemiplegia, diplegic, CP, hemiplegic or diplegic CP, you mean?
Yeah.
Yeah, so when
What
we are
do you-
asking also, that is why when we are general in the examination, general becomes very important here. So when I was asking weight, height, nutritional status. Here the nutritional status means if we see he is emaciated, is there muscle wasting, like this, you know. So ask this question also in general. If you don't have universal Q, but in the universal Q, if you are seeing obvious muscle wasting, you can comment on it.
But actually, sorry, Dr.
Yeah.
Noor, these hemiplegic patients are up to date. In height, I have seen many hemiplegic patients, even adult people. They build and everything is maybe the normal adult height and weight, but they are difficult in using that side of the body.
Yeah, that can be there. Means it's because of the physiotherapy and occupational therapy.
Lack
But
of
it can be there, but still we should ask this question. Again, it depends upon the country he is in. Developed countries, yes. Developing countries, maybe they may not have that much of access. And
Our exam is developed country.
yeah. But still you have to ask this question. Nutritional status is
Yes.
very important. Include this in your template. Okay. You have to comment on the muscle wasting if it is there. They can bring you, they will bring clear cases, no confusion cases. They can bring you like this. Okay. So we will go for our next case now, if no
Okay.
comment. So I will keep the time for you.
What
Because
was the case?
after reading the case, I will give 3 minutes for you, because
Okay,
let's make ourselves active in less time, so that in the exam by 4 minutes we will be ready.
Okay.
Okay.
So what was the case?
I will give you 1 minute reset. Okay, so your case is 11 years old boy.
11
He
years.
presented with syncope, and on examination there was murmur in the left upper sternal edge radiating to back and carotids. Okay. On examination, his dorsalis pedis is weak, femoral pulses are weak. There was difference in BP in upper limb and lower limb, with higher BP in upper limb, and there is radiofemoral delay. Okay. Task is to explain the diagnosis and management to mother.
Okay.
Mm,
Okay.
Okay. So 3 minutes from now.
You did not tell the name.
Okay, name of the boy is John and name of the mother is Riza.
Please.
John and Riza.
Okay.
Please draw. If I will share the board. Just check if you can draw.
I will. I don't know. My drawing is. I'm drawing with my. Cannot draw properly. Okay. Just 1 minute. What happened? This.
Okay, just 3 seconds left.
Okay.
I will set 6 minutes now and then you can start.
Okay.
Okay, you will start now, 6 minutes.
Hello. Good morning.
Okay, start. Okay,
Good morning.
good morning.
I am Dr. Adnan, one of the child and adolescent doctor. I believe I am talking to Riza, mother of John.
Yes, doctor, it's me.
So I am here today to discuss about John's condition. So would you like someone else to be present?
No, doctor, I came emergently with my son because he had collapse at home. I don't
Yeah.
know really. No one is around. You can go ahead. I am worried.
Okay, I can understand your worries. Yeah, so what do you know so far about John's condition?
I don't know, doctor. At home, suddenly, no, actually, outside he was playing football near the house, and suddenly he had some collapse, and we rushed to the hospital. This is the first time happening to him, and doctors examined him, and they told one of you will talk, and you're the one who have come to talk to me.
Okay. So after examination of John, what we are thinking that John is having a condition called coarctation of aorta. So do you have any idea what is that, or have you seen
Oh, no.
any child with that?
No, doctor, I have never heard of this medical term. Can you please explain to me?
Yes, definitely I will explain. And if you have any question, you can stop me anytime. Okay,
Sure.
if you not understand.
Okay.
So actually, what is this coarctation of aorta? In a simple word, I will say that this means narrowing in the aorta. Aorta, I will tell you, in heart, there are two big blood tubes that
Oh,
is originated from the heart. You can see in the picture, this is the on the right side and on the left side. Now I cannot draw.
okay,
So
okay,
this,
okay.
yeah, on the right side, we call this pulmonary arteries that carries less oxygen blood from right side of heart to the lungs, and on the left side there is a big tube, blood tube, that is we called aorta, that carries oxygenated blood from left side of heart to all parts of the body. Am I clear so far?
Yes, doctor, but what has happened to his aorta now?
So this is actually this is we called coarctation of aorta. That means there is narrowing in the aorta. Like I have draw here, there is narrowing of this part. So
Oh my
for
God,
that,
my child has this problem in his heart and he's 11 years still now. I never knew how this was missed, doctor. How so many times I bring my child to, he has many up, sometimes flu. We have come so many times.
yeah, actually this is in the blood tubes. Defect, this narrowing is in the blood tubes. This is not in the heart itself, but still, the heart has to pump the whole blood to the body. So here heart needs to be pumped forcefully against this narrowing. So it may
Okay.
affect the heart also, you are right. And regarding why it not pick up early, sometimes it's mild in the early stages of life, So it's very the most of the childs, they don't have any symptoms, and they present late. Are you with me?
Okay. Yeah, doctor, I want to ask you, now he's 11 years old. Do you think that suddenly this has happened? This has happened to him suddenly? This can happen like this to children?
This is a good question, Ms. Reza. I will tell you that this is usually most of the heart problems are present from birth, but sometimes they present late and sometimes they present early. So it all depends how it was severe. Uh, Sometimes it may be very mild and it present now at the age of 11 years. Am I
Mhm.
clear?
Yes, doctor, and they also told my child's BP is blood pressure is increased. Now I am worried. He's just 11 years old. We see old my grandfather like this. We used to see of blood pressure in a child. I am hearing that he has blood pressure for the first time. So what I prefer is I want to stop this process completely. I want surgery immediately. How fast you can arrange for surgery for him?
Yeah, I can understand your worries. Yeah, he's having in the upper body is having high blood pressure, and in the lower part, this is all due to the narrowing. So there is narrowing at the part of this blood tubes called aorta. So for surgery, definitely we will refer to the heart doctor, and they will do some test also, like scan of the heart, we are doing, you have done maybe during pregnancy, this is jelly scan. Then they will do some uh, electrical, this ECG, that is electrical activity of the heart, to check how the heart is working now, and if there is any effect on the heart itself or not.
Okay, 6 minutes, three minutes
Are
left.
you getting my point?
Yes,
Okay.
yes, doctor. 3 minutes left. Okay.
Okay.
Uh, okay, doctor. Now I am worried. He has BP and he fall down. Maybe I will take him home. He will fall down again. I need some immediate action for him. What can you do for him now?
We will refer you to heart doctor, and he's the best person, and he will tell you each and everything. If the John needs surgery or any other procedure, like sometimes they are doing keyhole procedure, we called it cardiac catheterization, and they wide it the narrowing part, or sometimes they need surgery. So he's the right person who will do, uh, uh, and he will tell you each and everything. Okay. And for that needs to do, as I told you, echo, this is jelly scan, and ECG also. So at the moment he's doing fine, so we will just
Okay.
refer to heart
Doctor,
doctor.
till then, any medication will help him? Any medication I can give him? I want to reduce the blood pressure for him immediately. And also, as I told you, I see in big old people, not in small children. So I want immediate
Yeah,
medication
this
to do some action for him. And also, I am
yeah
afraid of
this
collapsing. So how can you help me?
yeah, this one is completely different kind of blood pressure. That was in grandpa, that was different. So at the moment, we can consult with the heart doctor, and if John needs any medicine, we can start medicine for the blood pressure. At the moment, we will consult with the heart doctor for the further follow-up, for if he needs surgery or anything else. So we will refer you to the heart doctor.
Uh,
Okay.
Oh, okay, doctor. Do you want to admit him now?
So well, as he was presented with loss, with syncope, as you told me, and definitely we will keep him here at the moment, and we will uh, further examine for further time of period. Okay.
Okay.
And how the things going on, after that we will decide.
Okay. Okay, doctor.
Okay, and if you don't have any other concern, may I summarize what we have discussed today?
Yes, doctor, sure.
Yeah, so I have discussed about John's condition, and what we are thinking that John is having a condition, coarctation of aorta. And I have told you about what is this, and I have told you we need to refer to the heart doctor. He's the best person who will decide
Okay, time
what to
finished.
do
Just
further.
finish your,
Okay,
okay.
and I will give you some leaflets and trusted website also. Thank you very much.
Okay, thank you, doctor.
Yeah.
Okay, well done. It was good, but some jargons were there.
Which one?
You said,
Oxygenated is normal.
no, you said cardiac catheterization.
No,
Better
no.
people have used
I
that
use
word.
this one keyhole procedure called cardiac catheterization.
You
You did
told
not listen.
all, maybe I missed it. Yeah.
Yeah, keyhole procedure called cardiac catheterization.
But more than keyhole, before telling, you could have explained that through the tube, we go from the big tubes and try to make this narrow opening broader like this. You
Yeah,
can,
that one
it
can
will be
also
called
use.
keyhole. Keyhole is for laparoscopic, right?
Actually, this one I have taken from Gauche. They have written that keyhole procedure called cardiac catheterization. This word is I have taken from the
You can send
great
me
organ.
the leaflet so that quickly we will just go through on my phone.
Just 1 minute. Just 1 minute. I have this one. I will send you.
Okay.
I just read yesterday, so it will be where, yeah, here.
Planning is whoever prepares from anywhere, let us discuss so that this case is finished with all of us like that. So
But
that
one thing I don't know, Dr. Noor, you will give me feedback and I will tell you. One thing I did not know, I have told myself, I
we
was
will
thinking
just,
maybe this is wrong information. I have sent this one, open this. So you can open.
yeah, I will share in my computer and open for you. Before that, I will give the feedback. Okay, just wait.
Okay.
Okay, so for the this for your feedback, what I thought is when she told you that I am worried, doctor, because he's collapsing. I want to control his blood pressure also because I see it in old patients and not in children. You could have told her that we will admit him and observe him in the hospital. You told
Yeah,
him
this
when
one I
she asked
told.
direct question. When she
Yeah,
asked,
that's why I want this feedback. I don't know this answer. I told that we will admit him, but I wrongly said that we will consult with the heart doctor for the medicine. I don't know. We should consult or not.
yeah, you
I
can
don't know
tell
this one.
because it is a case of collapse. And sometimes what happens when the syncope comes, what are the two systems you will check in syncope? This is my view. I can be wrong, and Dr. Yasser is the third one here. He can comment after I comment. So my view is in any syncope, two systems are important for you. One is CVS, another is the CNS. Okay.
Yes.
But here by your case, it is very clear that it looks like the cause is CVS because by your clinical examination, you have murmur, you have increased upper limb BP, and you have weak dorsalis pedis and femoral and radiofemoral delay. So it is the cause is going with CVS and coarctation of aorta. Okay.
Yeah.
So now when you have a cause and he presented with syncope and the mother is worried. So you still jelly scan is not done for him. And she is telling that if I go back, he has hypertension now. And if I go back, he may collapse again at home. So you can, there is something called, you can admit him and discuss with your consultant and involve the heart doctor. Once he's like the heart doctor, what he will do by the jelly scan, he will see, right, how much narrowing is there, and what are the indications of surgery and cardiac catheterization. All these things he can put a plan, and then he can give a time. And she is asking for medication. Definitely we are not knowing whether they will give him some medication or not, so we will put on the heart doctor. So you can tell that if you are worried, sometimes socially also we will admit the patients. So you can tell her that if you are worried, we can admit him. I will discuss.
Because this,
Consult.
Dr. Sridevi, she was saying that she got the same, I think.
Hmm.
Sridevi or Bindia, I think Bindia.
Hmm.
Dr. Bindia got. So she was saying that you cannot give any medicine. You just will refer to the heart doctor and you will say that uh, like he will give each and everything. We will consult with the heart doctor, which
But
I
the
remember.
thing is, before consulting with your consultant and heart doctor, he is not a
Yeah,
patient to discharge now, because mother is worried. She will take back and he may collapse. This is her concern. So you will
yeah,
tell
yeah.
her that otherwise, instead of telling about admission, at least you will tell her that I will arrange a meeting with my consultant as soon as possible, and also a heart doctor, so that we can do the jelly scan for him and see his condition and give you the best option in the treatment, like this.
Yeah, yeah.
Okay,
That's what.
before discharging him without doing anything. Okay, this is my view. But we can go through the
Yeah.
coach if he has given any points. And if
No,
doctor,
no, that is not given. That is for actually new net.
okay.
The old one I could not
What
find.
did Bindya say? What did Bindya say? Was this question asked for her about medication?
Yeah, yeah. This lady was asking from Bindia, from Dr. Aftab. He also got the same, and he was saying that we cannot do anything. We will just say that we will refer you to the heart doctor. And he's the best answer. He's the best person who can give this answer. So he can give only answer. But if there is a question that how you can discharge, so definitely we will not discharge. We will keep like I said that we will keep this John here, and we will monitor, and we meanwhile we will try to coordinate with our consultant or this child heart doctor. So like this we will have, because if the mother wish and he's saying that he cannot handle at home, so we cannot discharge. This is clear cut. This is in the guidelines. At the same time, mother is saying that I cannot, even in the bronchiolitis. Bronchiolitis is not an emergency. In case if this is the red flag, if the mother is saying that no, I cannot handle at home, so please keep him at hospital. So you'll have to keep.
Yeah, yeah. Okay, depending upon, that's what I am telling you. This is the
Yeah, yeah.
worry for her now. And this discrepancy we did not tell. And regarding your drawing, I will try
No, no, no.
help.
That I was drawing with my this finger. That's why. My
Okay,
drawing is very nice, really. I
okay.
was drawing with my finger.
Okay, so after drawing the four chambers, instead of
Yeah.
starting from the upper chamber, draw it like a normal heart. Means to understand, this is the left side, and there is some. I am also trying. Maybe I may not do properly also. You can show her that there is narrowing here because of the narrowing, and from here it has become narrowed. So if you show her clearly, then you can tell her that through the keyhole we can pass some tube and try to make this dilated like this, so that it can become
Yeah,
normal like this. You can tell her some points, and we can put some device here like stent if she asks in detail. Otherwise, no need to tell you. I'll put on the
yeah, yeah. No
doctor.
need.
Just I am telling you. Suppose if they insist, sometimes they can insist. No, doctor, I want to, can you explain how like this? We don't know what can be their question. We have to be ready. So I'm just telling, in case if they ask, we can tell that they will remove this narrowing and try to make it straight or something like this. Okay. In the operation, usually they will cut it and they will join it, right?
Yes. Sometimes before they were doing this bypass surgery also, but now I think they are doing end-to-end anastomos or this one stenting. because
Like
now
this.
stenting is very nice. They
Yeah,
are doing.
it's cardiac catheterization.
Yes, cardiac catheterization.
Yeah. So that is one thing you have to tell.
I will ask my brother what they are doing. He's the cardiac interventionist. He will tell me.
Okay, okay. He's working in UK.
Yes, yes.
Okay, great. For what? Pediatrics or adults?
No, he's adult, but he can tell. Definitely, he's doing cardiac care daily. So some people are coming there. I will ask him.
Okay, okay, great. So this is what is the thing. Okay, so drawing you can do it like this. Another thing, your answer was very correct when I asked like why no doctor picked up before. Maybe it was mild and gradually it is becoming severe in him like this when he was child. Maybe it was mild and gradually it is becoming severe in his as he is growing up, and his needs means especially he had an attack during play means the physical activity will increase the demands, right?
Yes.
Yeah, this is the reason. Same like aortic stenosis. The difference between coarctation of aorta and aortic stenosis is the stenosis will start here, the coarctation of aorta little far away, right? So you can
Yes,
have the
right.
same presentation. The only thing is the pulses difference in the upper limb and lower limb because the upper limb arteries will start before the coarctation of
Yes.
aorta. So, what is the right position for murmur in coarctation of aorta?
This is infraclavicular.
Okay, which infraclavicular, left or right?
Left.
Left infraclavicular. But in the scenario, I think they did not tell this. They told in the left upper sternal edge.
Yeah,
This
but
is what David
correct is
told me.
infraclavicular murmur is there.
What? Yeah, this is
Yeah,
left means if we sorry, this is right side. Wait, I'll clear the line. Suppose if this is the clavicle, you are telling here left infraclavicular is the
yeah.
site for murmur for coarctation of aorta, but in the
Yes.
exam
Yes.
they had told left upper sternal edge radiating to back and carotids.
That is, they have given very clearly because there is, they have given very clearly because radiating to carotid is only from the aorta.
Only from the
If
aorta. It can
yeah,
both from aortic stenosis and coarctation of aorta, both.
yeah, both
And
because aorta is radiating to the carotids. Others, here can be murmur of PS, here can be pulmonary flow murmur, here can be ASD murmur, here can be another AST, pulmonary stenosis, and PDA. So all murmurs, they are not radiating. Only the radiating to carotid is coarctation of aorta there will be.
yeah, and also for the back is in between the scapula.
Yes, in between the scapula. And if it is right side, then will be aortic stenosis. On the left side is coarctation of aorta only.
So that
That
is
is
what they have
radiating.
given. Left
Yes.
radiating to carotid means here the pulmonary is gone. You cannot say
Yes.
pulmonary stenosis. Even though they
No.
have given
Yes.
left upper sternal edge, radiating to carotid is giving you that the problem is carotid. Sorry, it's aortic. And the clue for you to conclude coarctation of aorta is the difference in BP and the
Pulse
radiofrequency
weak.
delay.
Yeah. Peripheral pulse is
Yeah,
weak.
and the
Yes.
two things radiating to carotid and back, these two things.
Yes.
So I think the case was quite clear and nice. This case came in two places, you know, right?
Yeah. Two places. One, it was came on 29th in online, and one it came in Jeddah
Yeah, Jeddah last day.
last day. Yes.
Oh, I don't know. They are repeating the scenarios.
Yes, they are repeating, Dr. Noor. They are repeating the scenarios. And nowadays, they are not bringing up these difficult scenarios. I don't know till that time we will get any seat or not, especially for us, because we are not in Saudi Arabia. So we don't know we will get position or not.
No. There is too many online exams coming. You just keep preparing. Inshallah, you will get some more.
Yeah, inshallah.
So tomorrow's Dr. Yasser, you have any comments for this coarctation of aorta?
No, no, most of them you have discussed. Wherever in the treatment comes, we always involve our consultant and subspecialty domain. This is not our domain. And second thing, the murmur involving the blood vessels, that means heart vessels, always radiate, just like
Yes.
pulmonary stenosis and this one coarctation of
Okay.
aortic stenosis, they are radiate. So just keep in mind, but it's very difficult because here AST, this HOCM, and this coarctation of aorta. These three murmurs are only clinically. It's very difficult. I have seen a lot of patients in Children's Hospital in Lahore. Well, it's very difficult. Others, PS, we can identify. AS, we can identify. MS, MR, we can identify. But only location and maximum intensity and peripheral stigmata, then we can identify. Otherwise, very difficult.
Yes, definitely. Very difficult. Yes,
Means
yes.
you were telling the differential diagnosis for the left infrascapular murmurs, you mean?
Yeah. This is aortic
So to
So what
ASD, HOCM,
is
and hypertrophic optic cardiac, PS and PDA. These are the four murmurs. But PS and PDA identified very easily. But this ASD and HOCM and the coarctation of aorta very difficult to identify. Just the peripheral stigmata and the maximum intensity, then we can identify. And here that fourth is
here this
endocrine.
ASD, and I can agree with PDA and coarctation of aorta. For ASD and pulmonary stenosis, you will still hear under the left infrascapular.
No, AS suprasternal and the right side.
yes.
Aortic stenosis on the right side and suprasternal notch. When you, I have seen a lot of patients in there. When you put your notch, you feel the thrill in the suprasternal notch, even on the right side in the this aortic area. You also feel the thrill in that
For
area.
AS, aortic
In
stenosis.
AS, yeah, in AS.
Or who come?
Hook'em is very difficult.
Actually, hokum is sometimes present like AS.
Yeah.
That's why, yeah, that's why difficult.
So whenever any other syncopal, this AS, aortic stenosis and HOCM, and this arrhythmias, will Parkinson White syndrome leading to SVT and tachycardia. So these are the always keep in mind. And fourth is endocrine. Once is neuro CNS, and third is endo hypoglycemia, Addison. They can also present with syncopal attack.
Yeah.
So these things to keep in mind.
Okay. Okay, then.
Okay, we are done.
See-
Tomorrow's plan, let's put before going. So tomorrow again we will meet at 6:30 p.m. 6:15 or 6:30. So tomorrow you will prepare the development case, Dr. Adnan. You are free.
Yeah, which one? Grass motor I can prepare.
Anything you can prepare. Just the topic
grass motor.
will be Williams syndrome. Okay.
Or fine motor or grass motor, anyone you can give.
Fine motor we did today, so better to
Okay.
do another domain, either speech and language or gross motor. Don't tell what for
Grass-
him, so that
Grass motor
go.
is, yeah, because I have not studied this one till now. Speech and language I have studied 2 years back. So
Okay, speech and language. There is one video before. Maybe I have sent you. Just put speech and language. I just read from Twitter sheet. If you want, you can hear. Otherwise, prepare gross motor only. Anything, no problem.
grass motor I will
Let's go on
prepare, and
complete.
speech and language we will also do, no problem. We will repeat this one definitely.
Okay, no, because
Gross motor
according to 4 tasks we will finish. Each one of us take one. Today I did as a candidate. Tomorrow Dr. Yasser will do as a candidate. Then later, see for the today is which day?
Okay,
Sunday.
tomorrow is doing Dr. Yasser, huh?
Yasser will be candidate and you will be
So
the
I will be role player for grass motor for Dr. Yasser.
No
And the
problem.
third day speech language I will do. on
Okay.
Tuesday. I am trying to manage. I will manage, inshallah.
Yeah, try to read. Without reading, we will not do, because
No. Grass motor, I will read today.
Mm.
And Tuesday, I am trying to manage my duty.
Mm.
And if you will start to 12:15, I will be free, inshallah. If I will manage, inshallah, duty. And I will do speech and language.
Okay,
Okay.
see, Tuesday is Monday, Tuesday. Yeah, Tuesday and Wednesday I have evening duty. So if you people can make out, we will do at 12:15. Otherwise, I can do some other thing, general meeting I can do. Or I will read myself
I
something.
think I will be. I think I will be free. I will change my duty.
Okay,
I think
if
so.
you
I
can,
will ask.
we will just inform me tomorrow. If you can, at
Okay.
15 we will do. Otherwise,
Okay.